Hi, I'm Gabriela Valareso Gallardo. I'm going to talk about the coronary artery bypass surgery in the patients with ischemic cardiomyopathy. The definition: the survival benefit of a strategy of the coronary artery bypass grafting added to guideline-directed medical therapy as compared with medical therapy alone. In patients with coronary artery disease, heart failure, and severe left ventricular systolic dysfunctional remains unclear.
The area will be scrubbed with a special disinfectant soap and may also be shaved. The surgeon will then make a 6 to 8 inch incision. The heart sac is carefully pulled back and the heart is examined. At this point, the doctor will remove the necessary graft vessels for the artery bypass. Most commonly, an artery from the chest called the mammary artery and/or a vein from the leg are used. However, an artery from the arm or wrist may also be used. Once this is done, the bypass procedure can continue. At this point, the heart will need to be cooled to keep it still. During this time, the heart will be connected to the heart-lung bypass machine. After giving a large dose of a blood-thinning medicine called heparin to make sure that the blood does not clot, the surgeon will connect the heart to the heart-lung bypass machine with a plastic tube. Blood from the heart is then sent to the bypass machine through this tube. The machine supplies the blood with oxygen and then pumps it back to the rest of the body through the other tube. While connected, the blood simply bypasses the heart and lungs, but still reaches the rest of the body. After being connected to the heart-lung bypass machine, each of the blocked coronary arteries will be carefully inspected. The surgeon will determine the ideal place to attach the new vessel or vessels. Usually, the vessel is sewn into an area below the blockage and then into a location in the aorta.
We have the application of medicine. In patients with coronary artery disease, heart failure, severe left ventricular systolic dysfunction remains unclear.
We will show how a coronary artery bypass graft, or CABG, is used to treat coronary heart disease. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. The network of blood vessels that branch over the surface of the heart are called the coronary arteries. Coronary heart disease occurs when fatty deposits build up and form a plaque or atheroma on the artery wall. This causes the artery to narrow and harden, reducing blood flow to the heart. A CABG can bypass the blocked arteries so that blood can flow more easily. A coronary bypass graft, or CABG, is carried out under general anesthetic, which means that you'll be asleep during the procedure and feel no pain. If blood vessels from your leg or arm are being used for grafts, your surgeon will remove and prepare these first. A blood vessel, such as a superficial vein in the leg, which lies just below the surface of the skin, can be removed to use as a graft. A cut is then made down the middle of the breastbone or sternum, and the rib cage is opened so the surgeon can reach the heart. The surgeon may attach the new grafts while the heart is still beating, but it's more common for medication to be used to temporarily stop the heart. The blood is then rerouted to a heart-lung bypass machine. This takes over from the heart and lungs. It adds oxygen.
Then we have the pros and the cons. The pros is we can find less heart damage, eliminate the need for a bypass machine, shorter hospital stay, lower mortality rate, especially among women and patients high risk, and the cons we have stroke, heart attack, and death. Then
or atheroma on the artery wall. This causes the artery to narrow and harden, reducing blood flow to the heart. A CABG can bypass the blocked arteries so that blood can flow more easily. A coronary bypass graft, or CABG, is carried out under general anesthetic, which means that you'll be asleep during the procedure and feel no pain. If blood vessels from your leg or arm are being used for grafts, your surgeon will remove and prepare these first. A blood vessel, such as a superficial vein in the leg, which lies just below the surface of the skin, can be removed to use as a graft. A cut is then made down the middle of the breastbone or sternum, and the rib cage is opened. So
we can find the issues apply in Ecuador. The Ecuadorian Institute of Social Security, ISSI, through its hospital Joaquín Carrasco Arteaga in Cuenca, perform a set of heart surgeries include non-surgical transplants. This is accompanied by a modern system of three-dimensional images with your computer cardiac 3D. Through this service, cardiovascular surgery will perform surgeries, coronary obstructions, aortic valve replacement, correction of the congenital cardiac malformations, among others. Some of them are only treatment at home. Finally, we have the conclusion. In conclusion, of patients with ischemic cardiomyopathy, the rates of death from any cause, death from cardiovascular cause, and death from any cause of or hospitalization for cardiovascular causes were significantly lower over 10 years among patients who underwent CABG in addition to receiving medical therapy than among those who received medical therapy alone.